Today, I'm going to provide an overview of the Victorian Integrated Cancer Services Survivorship Program, also known as the VICS Survivorship Program. So from how the program was developed, the activities we've achieved so far, such as the environmental scan, and the development of survivorship care catalog, and the upcoming milestones of the program. Next slide. A bit of background on the program itself. So between 2022 and 2024, the VICS was partnered with the Australian Cancer Survivorship Centre as part of the Victorian statewide collaboration to improve cancer survivorship care. And this partnership resulted in the development of really valuable tools and initiatives to support Victorian health services in delivering high-quality survivorship care to cancer patients. Building on this work, the VICS truly remains committed in improving access to high-quality cancer care. Through the survivorship program itself, the VICS continue to aim to support better access to improved quality of life of cancer patients who completed anti-cancer treatment through supporting member health services across Victoria to adopt known cancer survivorship models of care. So with the support of the Victorian government, the Department of Health, and the VICS survivorship program, we really wanted to aim to increase the number of health services implementing these models of care. We wanted to achieve measurable improvement in patient outcomes, such as quality of life and satisfaction of care, and generate really good insights to guide for future service improvement initiatives. Next slide, please. So one of the activities that we've achieved so far is we conducted an environmental scan of the current survivorship practices, challenges, and the areas of need. So what we did is we conducted a survey across our member health services to ensure that the work that we're doing is actually relevant, practical, and aligned to what the service needs most. And to support this, we developed a comprehensive online survey. This really helped us to better understand the process involved in survivorship care initiatives, and we utilized the tool RedCap for this. The survey was then distributed to known VICS networks and stakeholders for over a 6 weeks period. And during this time, we received 67 valid responses from acute services, along with additional 9 responses from community health services and non-government cancer organizations. The responses were analyzed and aggregated, and it really helped us to shape a comprehensive survivorship models of care catalog for health services to reference to and to kind of help adapt to their local needs, which we are really excited to share with you. Next slide. So after a great deal of effort and collaboration with a lot of people, I'm really pleased to announce the Survivorship Model of Care catalog is now available online. You could access this using the QR code on the slide, actually. So this the catalog showcases a diverse range of survivorship models of care currently in practice. So this includes dedicated survivorship clinics run by nurses, health service-based programs for cancer survivors, allied health-led programs, support groups, and peer-based services. And we also managed to capture detailed information such as the tumor streams and the health professionals involved when the survivorship initiative or conversation are introduced during patient journey, targeted age group and population, service coordination and referral pathways, the time point patients are able to access the service, the resources provided during the survivorship encounters, and also the common concerns addressed in the survivorship care appointments. If you would really like to learn more about the catalog itself, we really encourage you to contact your local ICS. And later today, again, as Justine mentioned, that we are going to learn from the really good examples of established models of care in survivorship care across Victoria. And in my opinion, of course, having a resource itself is not going to be enough in implementing really good cancer survivorship care. So it's what the effort that we're going to be implementing and me managing it to be sustainable that truly makes a difference. Next, please. So that's why we are really proud to announce the grants program. This is really designed to support health services in embedding survivorship models of care into existing processes and programs. The VICS are really keen to work with health professionals who are interested in implementing survivorship models of care into processes within the VICS member health services. So in addition to the catalog, the VICS survivorship project leads could also be a really good resource, as they will provide advice on project management strategies and aiming to kind of increase the sustainability of the newly embedded initiatives. So the program has kicked off with the expression of interest process open to the public health services. And the local VICS has been assessing these EOIs and to determine whether local support is enough or if a full funding application will be submitted on behalf of the health service. Just a confirmation that all the funding applications will be reviewed by a dedicated assessment panel consist of consumer representatives. There will be GPs, survivorship care experts, and practitioners as well from metro and rural areas to make it all equal and make sure that what the initiatives proposed are actually relevant and sustainable. So what we are hoping to do is we're going to kick this off in the next couple of weeks, where successful applicants will receive assistance from the VICS to implement their survivorship initiatives in the health service. And what we're expected to do is expected implementation timeframe is kicking off in August 2025, which would go for about 12 months. So we are really truly excited about the potential of the program to support and scale survivorship care across Victoria, and kind of emphasize more that please get in touch with your local VICS if you would like to be part of the program and to find more information about the process and the eligibility criteria to participate in the VICS survivorship program.